Good morning, dear colleagues. So my task will be now to discuss with you the involvement of the muscular system in patients with sepsis. As a disclosure, I have to say that I have received a grant from Nestle to investigate the role of metabolic support in patients with sepsis. So the muscles environment is important to know before looking at the role of muscles in critical illness. So muscles are connected with epithelium, with connective tissues, and with nerves. The human muscular system is very important in the functioning of organizing movements, has a role in warmth, a role in posture. Muscle properties include ability to contract, ability to be stretched, and ability to respond to stimuli. And there are, as you know, many different types of muscles, the skeletal muscles, smooth muscles, as well as cardiac muscles. Motor units and the musculoskeletal system can be summarized in this graph. And of course, the function of and the contraction of muscles is under the control of a nervous system. And basically, myofibers have slow motor units that are mainly involved in anti-gravity, weight bearing, and sustained movement. Fast glycolytic motor units that are involved in burst power, and fast oxidative motor units that are involved in sustained locomotion. Myosin is the muscle's motor protein. So myosin will control the production of force and movement by interacting with actin. So on these slides, one can see how the thin filaments that are actin interacts with the thick filament that is myosin to induce movement of segments of members. Myosin is a motor molecule, and basically there are two types of fibers: slow fibers for gravity support that are characterized by a low contraction speed and a high efficiency in force production, and the fast fibers involved in locomotion that are high contractions, characterized by a high contraction speed and a low efficiency in terms of force production. So muscle wasting is something of concern in patients with critical illness. To maintain the muscle mass, there must be a balance between protein synthesis and proteins breakdown. So in critical illness, muscle synthesis is important, of course, for muscle growth, and will depend on nutrition, exercise, and anabolic drugs. Breakdown resulting in muscle loss, mainly related to inactivity and immobility, to malnutrition, and to stress. So the human muscle response under different conditions of unloading is shown on this slide. So one can see here conditions: flight, bed rest, immobilization, and unilateral limb immobilization. And looking at the different types of muscles in the leg, in purple, in triceps surae, in red triangles, in gastrocnemius, in blue diamond, and in sulcus in green circles. So one can see over days, from 0 to 100 days in the x-axis, how the extent of decrease in muscle mass and muscle size over time with different conditions. And one can see that in particular bed resting, such as what happened in patients in the ICU, is associated with remarkable decrease in muscle size. Size and phenotype also of muscles are regulated according to loading conditions. So slow myosin genes represented in yellow here and fast myosin genes represented in red color and blue color, one can see that with a reduction in loading, the muscle will be switched from slow myosin genes to fast myosin genes. And to illustrate that, this experiment have evaluated the reduction in thigh muscle area after 1 month of bed resting. So, and according to intake of amino acids only, in green, amino acids and resistance training, in white, and in orange, the amino acids resistance training and optimal timing. So thigh muscle mass was reduced by 12% with the amino acid supplement only, and resistance training mitigated the reduction in muscle mass, highlighting how it is important not maintaining the muscle unloaded without exercising. Skeletal muscles and loading states. To conclude this section of a presentation, skeletal muscles require almost continuous weight-bearing stimuli to maintain normal protein expression in the contractile elements. If no gravity or no intermittent high levels of loading, protein degradation will be surpassing protein synthesis. The contractile protein milieu undergoes a net degradation and the muscle fibers become smaller. Slow myosin genes are turned off and fast myosin genes are turned on. The muscle fibers become remodeled to be smaller, weaker, and less effective to support movement under loading conditions. In critical illness, a recent paper by Hilse van Herbeek in intensive care medicine nicely summarized the pathomechanism underlying muscles involvement during critical illness. So basically, as shown on these slides, the factors causing the alteration in muscle function and strengths are multiple, and they include endocrine alterations with imbalance between catabolic and anabolic hormones. It includes also direct impact to muscle cells related to ischemia, causing necrosis, but also related to inflammation and also related to mitochondria dysfunction as a result of nitric oxide activation, both by inflammation and by hyperglycemia. And this alteration in the muscle system, in the muscular system, during critical illness translate into poor clinical outcomes, as shown in these slides, both in the short term and in the long term. So panel A showed the evolution of mechanical ventilation, longer stay in the ICU, longer hospital stay. And on panel B, one can see that also this translates into long-term alteration in the 6-minute walk distance performed by patients, has a significant cost and also impact the capability of a patient to resume a normal social activity. And finally, panel C and panel D showed that this impact of alteration in the muscular system during critical illness lasts for long term and impact long term clinical outcome as well. So how can we assess the muscles function during sepsis? And there are multiple methods, and I'd like to highlight and focus on a couple of them only. To start with is MRI. MRI has now become very familiar in ICU patients, and it's now much more convenient in many places to get access to MRI for the patients. And for example, in our institutions, we're able to perform the whole body MRI, looking at a single examination to the whole muscular mass of the whole body. And for example, here in one patient with sepsis, after 1 month, one can see in the thighs of the patients in the two sides how the muscle mass was reduced and replaced by water and fat. This is even more highlighted in the following slides, showing that both in the anterior and posterior muscles are replaced by water and fat. Also, like to focus on the assessment of respiratory muscle strength. So vital capacity is by far the lab test that is more commonly used worldwide, and as you know, need the patient's cooperation, of course. But when the patients cooperate, vital capacity can be very useful to identify respiratory muscle weakness, and in particular, diaphragmatic muscular weakness, in particular, when one can find a decrease in vital capacity by more of 20% from the upright position to the lying position. Also, if one can access to the measurement of maximum inspiratory pressure, again, one can access or have some information about diaphragmatic strength in these patients. Most interesting is the measurement of pulmonary transdiaphragmatic pressures, as shown here, where the black arrow shows in the upper graph normal aspects in diaphragmatic function, translating into variation in pressure in the esophagus and in the stomach. While in the in the bottom graph, one can see the alteration in a patient with diaphragmatic weakness. And I will skip the next one. And now also ultrasonic examination are very helpful, as shown on this graph, to at the bedside evaluate very precisely the diaphragmatic kinetic as well as contraction. So in conclusions, critical illness such as sepsis is characterized by altered muscle mass, strength, and function. The underlying mechanisms are complex and may include immobilization, inflammation, endocrine disorders, and drugs toxicity. Muscle mass, strength, and function can be easily and non-invasively detected and monitored during ICU and hospital stay. Altered muscle mass, strength, and function negatively impact short and long-term outcomes in the critically ill patients. Thank you very much for your attention.